want to say, in the name of this, behalf of this publishing company, it is a pleasure to be talking to two important authors this evening, and they are from Switzerland, and it's a huge pleasure for us to host both of you tonight. Welcome, Dr. Christian Köhler and Dr. Regine Reymond.
Yeah, thank you for this invitation.
Did I spell it right? Did I pronounce it right? The name of you guys?
I'm not a doctor.
Oh, you're not a doctor.
No.
You're a therapist, correct?
The name is right, correct.
Oh, the name is right. So yes. I'm sorry for that. So Dr.
Yes, Regine is the expert.
Regine is the expert.
Yes.
Regine Reymond and Dr. Christian Köhler.
Yes, I'm only for the practical things.
Oh, perfect, perfect. We really want both of you to feel at home tonight. We're doing this conversation, this chat. It will be edited, so and subtitles will be included on that. And the main reason for this is to, share a little bit of your knowledge, which we know that's huge, that both of you have a huge knowledge in this subject that we're going to speak tonight, especially because of this piece of art, which is the book that you have published, and we have the honor to republish here in Portuguese in Brazil. And I must say it's a bestseller here in this in this publishing company. So I will start with the theme of tonight, which is injection treatment of the lips. And I know that's a theme that you speak quite well about. Regine Reymond, which is an expert, and Dr. Christian Köhler, that has a practitioner view about the theme. So that's very interesting. We're going to have a very nice conversation, and probably our viewers will enjoy a lot to listen to what both of you have to say. So welcome here. Thank you so much. So both of you are from Switzerland, correct?
Yes, that's right.
I'm German Swiss. I'm the both of it.
Oh, great. Yes. And your country is very beautiful. Very beautiful country.
It's like you as your country too. Brazil must be a dream. Huh?
Oh, thank you so much. Well, I'll start speaking about Regine. Regine Reymond, it is an alternative practitioner, pharmaceutical representative, and co-owner of the company Easy Inject. Is an expert in the area of static lip treatment with hyaluronic acid fillers. Based on her professional activities, she is able to demonstrate almost 20 years of expertise in the use of minimally invasive injection techniques. Having partially completed a university course in medicine, she worked as a marketing manager for international pharmaceutical companies for several years. Since then, she has either organized or personally led more than 150 workshops, seminars, and symposia on topic of filler techniques. And she's also the writer and the author of the book 45 Filler Injection Techniques, correct?
Yes.
Well, we have here the book in Portuguese, which is a best-seller book here in this publishing company. Congratulations for your wonderful work.
Thank you.
All right. And I would like to talk to you about Dr. Christian Köhler. Correct, Köhler?
Yes, that's right.
Dr. Christian Köhler is an expert in aesthetic surgery, non-surgical techniques, and static laser treatments. For more than 10 years, he has been heading up the Prevention Center in Zurich, Zug, and Cannes, Switzerland. His specialist areas include procedures such as breast augmentation, eyelid tightening, and facelifts. Dr. Köhler has more than 18 years of hands-on experience in general, vascular, reconstructive, and plastic surgery. To date, he has also performed more than 50,000 non-surgical treatments with botulinum toxin and fillers. He's also a co-author of the book 45 Filler Injection Techniques. Well, I would like to welcome both of you.
That's right. And as you can see, Regine is the brain. I was just one hand of the book.
No.
But I'm quite sure that both of you together make an excellent team.
Yes. He was my controller. No.
Oh, thank you so much for being here with us tonight. And we would like to know a little bit more about the background of both of you. We can start with Regine Reymond. We would like to know a little bit from your background, your history, from the beginning of your career until today. Tell us a little bit about it.
Oh, what can I tell you? It is really a little bit difficult. I did a lot of things, and the most of them you already said, that I started to study medicine, but I didn't finish it. And I took a lot of sideways. I worked a long time in a hospital as a nurse, but not, as a practical nurse. Then I I worked a lot, and my favorite was, I worked many years for the companies as a pharma referent and marketing referent. And afterwards, when I visited my doctors, I had a lot of, questions about how to treat lips. And this was the time in which I got the idea to collect all those techniques during about 15 years, 20 years, working in aesthetic segments, different aesthetic segments. What do you want to know else?
Well, I imagine it was quite a challenge to write this book, right? A lot of work and a lot of research.
Yeah, 3 years work. It was 3 years work, and it started. Do you want to know how it started?
Yes.
It started, it was a little surprise. I needed some pictures from the Quintessence Verlag for my videos, for my company. And I called them, and then I told them that I make little lip videos and treatment videos, and I need some good graphics. And then they said, "Oh, it's really interesting, lip videos. So you have a lot of material. Could you imagine to write a book?" And I thought, "What, a book?" And then I thought about it and then I thought, yes, I really already have 25 techniques. I said, if 25 techniques are enough, we can start. And it was really, I fell into the cold water. And then I started to write, and they helped me a lot how to make the structure and everything, because I never wrote a book before. And then during my whole work with the 25 techniques, I got more and more contact to very specialized people who knew a lot of aging faces, the bones, the teeth, the skin and everything. And they had published things. They gave me all this. And over those bridges, I saw more techniques, more doctors, more inventions. And then I collected. And now we found 45 techniques, but now today I have 7 more techniques to complete the whole program. But now the book is printed and it's too late. But it's a never-ending story, and I got a lot of help from many doctors and very intelligent people.
Oh, that's an amazing story, and probably the more you collected information about it, probably you fell more in love with the area.
Yes, that's it.
Fantastic.
Yes.
Well, now let me ask your right arm, let's say like that, Christian Köhler. Well, tell us your story, Dr. Christian. How did you start medicine and your background till today? How did it happen? How did both of you got to know each other? How did it start this partnership?
Yeah, I started after my study time at the University Hospital in Zurich, Switzerland. And my first part was vascular surgery. And later I moved to the Department of Plastic Surgery. And some years later, I started with my own business. So the first thing in the office was to do filler injections and botulinum toxin. So yeah, there was just a small market in the first time, and we had no information, less publications, no books. And I know Regine for many years now, so from the pharma companies, from workshops, and later she called me and she said, "Are you interested to write a book with me?" And that was, yeah, the first moment. It was a bit crazy for me. But on the other side, it's a great honor, and she was so motivated. They said, "Yes, I have just a little bit time," yes. And that was a problem always. So I said, "I can help you with the practical part, so to produce pictures and videos, and I can do some small parts." And yeah, that was for 3 years. I think she did most of this book, and I'm very proud of this. So it's a great honor to present this work with her today. So it's Regine's book at the end, okay? And there's, just to let you know, there's a small part of Brazil inside, because Maurício de Maio, he was 3 times in my office. So we did some workshops together, and he invested, or he showed some techniques. So they are presented in this book too, maybe.
Oh, great. That's good to know. Yeah. Well, congratulations about this amazing work that both of you have accomplished together. And we have a lot to discuss tonight about this theme, about this subject. So I'll just start with a few questions. I'll start asking Regine. Can I call you for the first for your first name, or would you rather me to use your last name, Reymond? Mrs.
No,
Reymond?
no, you can call me. I saw that I forgot to write the last name. No, it's okay. I'm Regine. It's okay.
Okay, Regine. So I would like to ask you: are all the techniques good? And after your answer, I would like to listen to Dr. Köhler. About how do you see it from the practitioner's point of view?
Mm-hmm. It's difficult to answer, because you cannot say all the techniques are good. You can say all the techniques isolated are good for the right indication, for the right skin, with the right doctor, with the right product, in the right time. You know, if everything is around the technique good, it fits and you get a good result. But you cannot say every technique is good for every lip, not at all. And even some techniques are more difficult than others. That means you have to have, for some techniques, you have to have more experience than the simple techniques. And, the most important thing is the ability to choose the technique. This is the most difficult thing, and this is what makes the difference between an expert who has a lot of years, who injected a lot of years and who tried a lot, between the expert and the non-expert, the beginner, for example. And then also the factor of the age of the person, the skin, the shape of the lip, and everything. You know, there are so many factors, and to choose the technique for the indication is what we tried to answer with the tablet and with the explanation and videos and so on. But no, not every technique is good for every indication. But every technique is good, yes.
Great.
Okay?
we would like now to listen to Dr. Christian about his practitioner point of view.
Yeah, the book, it's very helpful for beginners and for advanced people. So I think patients, they check this book, so because it's in the waiting room, and they are always interested to check out the pictures and to ask for some indications. So from my standpoint, we have many techniques, and the important step is to find the right one. This is what Regine said, so to find the right technique for the right patient. Many years before, it was much easier because everybody did the same technique, and all the clients, they had the same result maybe, but then it changed. We have younger and older clients, and it wasn't the same result later, and it was the time to change the technique. And now, as we heard, it's more than 45 techniques. So I think it's much more specialized, this area in the aesthetic surgery or aesthetic treatments today.
Great. Now I see why both of you make a huge team together, because you add a lot of information and a lot of knowledge from both sides. And congratulations for that, for both of you.
Thank you.
Well, Regine, I would like to make another question, to ask you another question. Well, how do you choose the right technique? Book suggestions. And after that, I would like to listen to Dr. Christian's point of view.
Yes, for example, if you have a patient with very thin lip, you can try to choose several techniques. It depends on your, how do you say, selfishness, how many experience do you have, and you know exactly what you need. It depends on your way, how do you make your analysis. You have to see the person from the side, for example, and see the profile of the person. Then it depends also which product you work. And then you can see it becomes smaller and smaller. You cannot make a volume technique number, I don't know it by heart, but number 32 to get a bigger lip. You have to look where can you how do you say, transform the shape, which techniques do you have. Then you see you only have 5 or 7, and then you can choose, do you take the cannula technique for this person or not, and when yes, why yes, and why not, why, or blunt needle. Do you take a firmer product or less firm product? Is it a young person, old person? And it becomes smaller and smaller, and you have tablets, and with the tablets you can see the indications, the different, and the products which you can use, which are nearly similar or not, and also the needles and everything. And then you can try with one, and you say, this is one I'm sure that I will do it. And then you can become a little bit differentiated, and then you make combinations of the techniques, and this is what the experts do. Then they make combinations of all techniques, because you don't, even if you have a small lip, and you cannot only fill it, you have to see the whole part. You have to see the little wrinkles. You have to look, if you bring the lip into a smile, you have to see how the chin is and the whole shape is, and all these points. You check it on the tablet in the book, and then you look on the chapter, and then you see the graphic, how to do it in theory. Then you see the photos of the film, and then you have a little video, and you go with your handy on the video, and you can see Maestro Köhler, who injected it by himself. And then it should fit.
Wunderbar. Well, Dr. Christian, what is your point of view about it?
Yeah, as we heard, that there are so many techniques, and from the practical side, it's I think the best option is to start with a workshop. Maybe you can try to book one with Regine. So it's so easy, because then you have a professional guide at your side, and they can assist you, because it's everybody is doing fillers today, but it's not an easy job. So you have to realize this before. And from my standpoint, it's important to know the basics at first. So what types of filler, needle, cannula, all the things. So you have to learn something about it, and then you can start maybe with an assistance. So to know what is important to realize. And there are so many things only for the injection, but around we have the informed consent. We have to show the side effects of filler injections. So there are many things around, and it's not an easy process. So what I think the best way is to start with a workshop for beginners, and then to go up with time, with more experience.
Yeah.
Excellent.
For example, it's for a person who never used a cannula before. Yeah. It's not very intelligent to start with a cannula in the lip, even if a cannula makes less bruising and swelling and things like this. But you should have experience with other indications before.
Mm-hmm.
For example,
I will ask you about cannula in the near future.
Yeah, okay.
And let's just ask another question to Ms. Reymond. Which are the most difficult techniques?
Oh, the most difficult techniques. It depends. For example, if you have a young, techniques are not so difficult because mostly the shape is very intact. The lip is firm. The muscle is round. So it's very much easier. But if you have older person, a lot of techniques can be difficult. It's not easy to answer. But for me, the most difficult technique, it's my personal opinion, is to elevate a lip if a lip is very, very thin. And there, it's not enough if you fill the lip. You have to make a combination with different techniques. And you cannot make a Russian lip or something like this, a big lip from a person who has very small lips. It doesn't work. It goes in front and you get a duck lip or something like this. It depends always on the anatomical status. Is it right to say status? And this can make every technique difficult. But the easiest technique is to take the blunt needle to go into the lip and to make a point. This is the easiest, but not always the best. But Maestro, what do you say?
That's what I was going to ask. I would like to listen to Dr. Köhler. What is your point of view about?
Let's take Christian. Christian is easier. So we are all at the same situation. So it's I think in my office, the difficult parts when patients, when they walk in and they show me the Instagram picture, and they ask me can you do it like this, and then I check out the client and it's totally different. So it's impossible to do the same and to discuss why it's impossible. So I think that's a new problem in the last 2-3 years. So especially for a younger generation, they identify with Insta posts and they think, okay, everybody can do it, but that's not true. So you have to spend a bit of time to talk to them and to find the right technique at the end. But it needs time, and I think you need a bit self-esteem to say you can't do it in this way. Yeah.
I think the main point of what both of you have said is the expectations of the patient, right?
Yeah.
We need to be speaking the same language.
Yeah. The expectation of the patient, the ability of the doctor, the product, and the status of the patient. These are the 4 points from my side of view who makes the result good or not.
And it's not finished at the end with the injection technique. So sometimes I offer the client a surgery. So you can do a bullshorn lift or some other surgical techniques. So there is something around, or we have to talk about permanent makeup. So we have some fields outside of the aesthetic treatments with filler injections.
Yeah.
Regine, what would you say to our viewers? Do you need experience to inject a lip?
Yes, of course, of course. If I imagine a person who never injected nasolabial foot or something like this goes with his syringe in my lip, oh, it's a horror. No, you have to have experience, but you can start very firm with my book, with our book. You can see how you start step by step without risking too much faults. But I think even if you have the book, it's always good workshop beside and to have someone who controls your ability with your Feinmotorik. Was heißt das auf Englisch? Feinmotorik?
Sensitivity.
Sensibility, yes, that's it. You have to have experience.
Excellent. And we would like to hear a few words about analysis of the mouth and how to analyze the lip.
Mm-hmm.
That's your part, Regine.
Yes. So you have different ways how to analyze a lip. For example, if you see the book, may I show the book?
Yes. I hope you're not analyzing my lip right now, okay?
No, I don't analyze your lip. I prepared something because I thought this question will come. For example, I don't know if you can see it in the video. If you see the lip, you can make different segments in the lip, and then you can, just a minute, this is here, different segments in the lip, and then you can see if there are asymmetries or not. And you can also see if the lip has a round form or a flat shape or not, or if it's in every part the same, if it's similar or not. And then you can always check from the side if the shape is from the side in the right form. There you have points. You can find all this in the book. Points of, how do you say? It's difficult for me in English. Marking points who show the beautiness. It's a definition of experts who did it, and then you can see, for example, if the underlip is too much forward and the lower lip is too much in front of the upper lip, you never can fill this with hyaluronic acid. You can only find a little line and angleichen, and you can try to make it similar, but you can never do it without making an operation in the bones, for example, if it's a strong asymmetry. So the analysis is one of the most important things. If I have a patient in front of me and she's speaking, for me it's the best way to see what happens with the lip and what happens not. Even if you have a very nice lip and someone speaks, the lip can roll or can be asymmetric or something like this. And after the injection, you can also see if everything is on the right place and everything is in the right line. If they speak, you have the movement, you have the profile, you have the front side, you have the forms, the how do you say that's schwer auf English. You have the what I showed you, the graphic, and then you can see. But normally, an expert like, for example, Christian, who does a lot of lips, he sees it without the help of a book. But with a book, the book is good to start seeing.
So it's very important to watch the dynamic, the movement,
the dynamic and the symmetry, and so on. It's very important to get an aesthetic view. You know what I mean? Even if you're a good injector and you cannot see if something is in line or not in line, it doesn't help, because you never know what you have to do. And this is, I think, a lot of people don't know really what they have to do, because they don't have the side of view. Is it right?
Yes, excellent explanation.
Is it English? Sorry, my English.
Your English is great, excellent. It's loud and clear.
No.
I'm sure that everybody will understand exactly the point of what you're explaining. Yeah. So do you think that a lip changed a lot can change facial expression?
Yes, yes, of course. I also in the book I made a nice experiment. I took the same face and I changed 10 times only the lip. And if you, for example, you see this, these two women, one is looking, this one is looking a little bit cold, distanced, and not very friendly, and she's looking a little bit, relaxed. But it's only the lip which changed. Also, for example, here, you can see those things, but I don't want to show you the whole book now. Makes a lot. And if you are injecting a lip too much, you change the expression of the face. Sometimes it looks funny.
I think that's an important aspect, because you have to check out the whole face.
Yes.
And the face in motion. I think many people, they forget this, so that they check out only the lip. But this is the second step, because you can change a person completely with this.
Yeah. Yes.
Well, I know that you have that on the book about the trends of the lips and how that has changed along the years. In the past few years has changed a lot. Yeah. Perception of the patients and what they really want with their lips. Very interesting.
Yeah,
well, go ahead, please.
Yeah, but if you see, for example, Marilyn Monroe or the old actresses, they all have beautiful lips, and they are still beautiful, but natural. Brigitte Bardot, for example. And today, it changed only that everybody wants a lip, and she wants to buy a lip in this form. And sometimes it's possible, but mostly not 100%. And this is what they don't understand. This is what Christian said. They come with an Instagram post and said, "Oh, I want the Kylie Jenner lip or something like this," and it does not work with a small little mouth and things like this. And this changed. It changed that we think that everything is possible.
Excellent. Well, we have spoken a little bit about cannula, but I'll ask another question about that. When do you see use of cannula? When do you use a sharp needle? And book suggestions for that.
A cannula is, I don't know if everybody knows what a cannula is. A cannula is a needle which is closed in front and has at the side a hole. And the advantage of a cannula is that you don't hurt the vessels if you go under the skin, into the lip, wherever. You only hurt the vessels a little bit if you make the how do you say the drop?
Incision.
The what?
The incision point of the needle.
The incision.
The entrance point.
Yeah, but for example, you can make a good combination between cannula and sharp needle. With sharp needles, you can work very exact, and you can place small amounts of material in small little areas. And this is good if you want to form the shape, or if you want to get it higher, the lip or something. With the cannula in the lip, you can fill it, and you can work very smooth in the zone around the lip. With a sharp needle, you can make the contours, you can make the fine, the fine reliefs you need, and you can give it, the surplus. You can make it more beautiful, a little bit higher, a little bit the philtrum and everything. You can never make a philtrum with a cannula because it becomes too fluffy, And with a sharp needle, you can place the material very, very exact, but you will hurt more vessels, and the swelling is mostly bigger, and we have bruises and things like this. But it's not dramatic. After a week, everything is very beautiful. And we have a lot of doctors who work only with cannula, I don't understand this, and only with sharp needle, I neither understand that. I think the combination is perfect. My opinion.
And
I
would
started
listen
after
to
I
Dr.
started after
Christian's
Regine
opinion
with
about this.
the cannula. I was working many years with the sharp needle. I was very happy with this because I think it's more for the straight lines. The cannula is more for the soft lines.
Yes.
And after this co-work with Regine, I started to use cannulas more often. And I'm happy today to work with both options because there are some areas in the face, so you can use the cannula very easily. It's more safe. There's no 100% guarantee to avoid the injection into a vessel, but I think it's more safe, and for beginners, maybe more under control. But you have to try both options by yourself, and sometimes people feel more comfortable with one option. Later, this book is helpful to try some new things, maybe with the cannula or with the sharp needle.
Mm-hmm.
Oh, excellent, excellent. So we have both point of views, which is very interesting for our viewers. And our viewers probably are asking themselves right now, what products do I choose for injections? Regine.
Also in the book, you will find a tablet about all the products and their for the lips and also for the other regions, because sometimes you cannot do all the lips. We took the most well-known products from Allergan, Galderma, from Tioxial and Merz, and those products everybody knows. They have a lot of studies, they are approved, so that's it. Then most of the companies have two kinds of products, a soft product and a firm product. For example, Allergan has the Vicrose product and the normal firm products. Galderma has, for example, the Emerald line and the Restylane line, and things like this are very important to understand. And this is also a reason in my book I didn't want to always explain how the product is. I made soft or firm, and then small XSS, medium, large, X large, like clothes, easy. And then you know the particle size, and you know the texture of the syringe. And then you have to think logical. If you want to fill a lip, only just think logical. You can never fill a lip with a firm product with big particles, because afterwards you have bumps in the lips, and this is not really beautiful, and the lips feel hard and soft and they are irregular. So it's logical that you use the softer products for the lips than the firm products, but you need, for making a shape or a contour, or you fill the small lines, you need a firmer product to have a lifting capacity or a shaping capacity. This is what I wanted to say. But which kind of company and which product, I think they are all really good. And I have no preference, even if I work very, very long time for Galderma. It's a nice company with nice products, but also the Allergan products and the Tioxial products, I love them all. And I mix it up, and it's very good.
And Dr. Christian, what is your point of view about that?
I think what Regine said, that's important. And you have to realize when we do a fat grafting today into the lips, you can't remove the fat and put it directly into the lip. So you have to prepare it to clean it. So we have some smaller elements, and this is important to create a soft look at the end. And with the fillers, when we started, maybe we had 2 or 3 different filler companies, but not different filler types. So that's absolutely new in the last year. So they create a filler with some special aspects, very soft, only for our lips, only for cheeks. So you have to learn something about the all these points of the different filler types. And then I think maybe it's a bit easier because we have fillers, and this is for the lips. It's a good option. So from the physics, and then you have to go to the next step to find your right company.
Great, excellent. Well, now I have a question for both of you. What would you give our readers as a good tip?
Buy the book.
That's an excellent one. Everybody will be happy with that. The patients, everybody. So how would you suggest to use the book?
I would suggest to use the book. The book is good for beginners, and the book is good for specialists. Experts. When you are a beginner, you can really look at the anatomy, things that you never see like this in one book. And you have the explanation of the fillers, the cannulas, the consultation, how to prepare a patient, how to make the documentation, how to be careful, the side effects, everything. But an expert knows those things because he's working since a very long time. But even if you see the different techniques and what they do, they make different things with the lip. An expert thinks about making combinations, get a good inspiration, and I'm sure 1 or 2 techniques he never knew before. I spoke with a lot of people, and they said, "Oh yes, this I never heard about," and that 2 or 3 techniques. The experts were working since 20 years. It's not, these are not my techniques. I only collected them. Don't change this. I only collected them from other experts, from symposium and so on. But it's not finished. If you start now as an expert, you take the techniques and you think logical, and you make combinations of them. You find perhaps the other 7 techniques I still invented for the next book. You know what I mean? Because it's logical. You have to develop it further and further to get better results and better results. So it's for everybody good.
That's why I said that this book is a piece of art, and it's a best.
Thank you very much.
Congratulations to both of you for this excellent work that you have done. Really good.
Can you show the book from the side, because then people can realize it's not only for beginners. When you show it from the side, it's there are not 10 sides inside. There's a lot of stuff inside, and I think this is for the beginners important to know. So you can learn many things. And for me as an expert, it was so interesting because Regine showed me every month 2, 3, 4 new techniques I never seen before. So, and I think that's important to realize. And sometimes it's good to go back, to think about techniques, and to learn some new aspects, especially for people when they work 20, 30 years in the office with this. I think there's a good chance to find some new stuff inside.
Yeah. Because the doctors I knew, even doctors who make a lot of injections, they only have their rituals, their habit. They make always the same thing, and this is what it's dangerous. They don't have time to visit the symposiums and the workshops, and because they're happy and fits what they're doing. And this how do you say? You have to create more fantasy. You have to become creative, and this was the reason I was so fascinated by all those techniques, and I thought it must be interesting for everybody. And I had a big chance with Christian Köhler, because yes, really, I needed a doctor who makes everything say, I asked 2 or 3 doctors before, and they said, "No, I never need the sharp needle. Oh no, I never need the cannula. Oh no, I don't make a big volume lip. Oh no, I don't make this. Oh no, I can." It was difficult. And Christian said, "Yes, Yes, I try everything. You have to tell me, and if that doesn't work, you write in the book why it does not work. And it was really a nice work because he was open. He was not, how do you say, a narcissistic person who says, what is she telling me? He was really open, and we had a really good dialogue. And if something didn't fit, he told me, look, Regine, this the arch is not so good. Perhaps we can make it better like this. It was really super. I had a big chance with him.
It was only possible with a strong teacher like you. So thank you very much.
Oh, no.
That's so nice from both of you to listen to that. Great team, great book. Well, let me ask Dr. Christian. Are there anatomical limits that should be respected, Dr. Christian?
There's a separate chapter in the book to talk about this, and we have some limits today because when you check out the patient before, they have sometimes silicone injections for many years, so you have to respect this part, and then sometimes we have to say, no, I can't do an injection, it's too dangerous. And we have some other things, so especially with expectations of the client. So you have to respect some points before the treatment, and you have to say yes or no at the end, because sometimes it becomes a bit more dangerous. So it's important to never forget this. Okay, there is a dangerous aspect with the side effects.
And that's the next question that I was going to ask. Are there side effects?
Yeah, we know some side effects. Some of them are more often, some are very rare. But so we have the swelling. Regine told us you can have a swelling, so if you use the wrong product, and you can have some hematoma. On the other side, we can close a vessel today with the filler injections, and then maybe we create a necrosis, or we create granuloma, or at the end it's possible to create blindness. So you have to know what is to do in case of. And I think we have some good ideas from other experts. They analyze what can we do, how can you treat side effects, because every practitioner, when you do this very often, there's always a risk that you have a side effect or an unhappy client. And you have to learn, how can I handle this at the end, because that's not easy. That's the most difficult part at the end. The injection, after a bit time, you can learn it, you feel comfortable with it, but with the first side effect, that's the important thing you have to learn, and you have to be prepared for this to handle it right.
And are there contraindications for lip injections?
Yeah, contraindications today, we know this. If you have an infection, if you have an herpes on the lips, so that's not good. Some medications, or if you have an allergy, it's not very often, but it's possible. So you have to discuss this with the client before, and then you can talk about maybe some other options or an appointment later, 2 weeks later, so after an herpes infection. It's not always the money in the first row, so it's the safety.
Are there age limits for this procedure?
What do you say?
No, not really, but it's more and more difficult if you have, for example, a person who has a lot of wrinkles, and the texture is old, and the lip is thin, and so on. It's really difficult to treat those lips. I love to do it because they're really happy if you have a small result, and it's a lot of work because you have to inject totally different than to make just volume into it. But you can never reach, for example, 20 or 30 years younger person. Never. You can make it better, but no, it's not really good.
That's exactly what I was about to ask. What should be considered when injecting an older lip?
Yeah.
This is your part, Regine, because you love it to do all our clients with a treatment plan. It's in the book too.
Yeah.
How can you handle this? It's not one session. You have to talk about 4 or 5 sessions. This is your specialty.
Yeah. You know, if you have an older person, you don't have only a lip to treat. You have the oral commissars. You have in English, you have the whole party around the lip. You know, everything is old, and you have fat compartments who are gone, and so on and so on. You can find everything in the book. And so you have what Christian said. You have to make a treatment plan. At the beginning, you need more injections than one injection for the lip. And this is, you have to know what you can reach and what not. And this is a very important thing. And before this, you have to make a good analysis and a good conversation with the client to tell them how much it costs, how long it takes, and so on and so on. But if you speak about only about the small lip and the perioral wrinkles, only this, you have to also to choose special techniques and to treat them very, very careful and again with small amounts of material, with thin needles and so on. And then you get good results, but you never get a young lip in an old face, never. Or Christian, perhaps you, but I don't think so. That's realistic. It's difficult to treat old lips. But all the persons are more happy if you reach something, and so it makes me happy.
Always have to listen to patients' expectations and see what it's possible to do.
Yes, the discussion is the most important thing, to show them everything, what happens with the older face, what changes. I always want to see a picture when they have been young, and then I put them together, and then I show them the difference. And then they can see that it's not so easy, but then you can start, and then you can have nice results, whatever.
Great. And talking about Switzerland, what is the trend in Zurich?
Christian, this is your part.
in the moment, I don't like it so much, because we have different age groups. So we have the classic patient in the office. So for lip treatments, they ask for a natural result, and the youngest clients now, they check out more Instagram pictures, and they ask for unnatural results. That's totally new. I think it's in the last 1 or 2 years, and yeah, I think we have doctors, they do this very easily. They say, okay, sit down, I can do it. For me, it's more difficult, because I don't like it. And you can't do a good job if you don't like it. So, and that's maybe I lose some clients, but I think at the end it's important to feel comfortable with it. And I do bigger lips, but not in an unnatural way. So I have to analyze the face around, the person around, and yeah, many clients, they walk in and they say, oh, have you seen these big lips outside? So I hope it's not from your office. So and this is where we talk about, so people are a bit more anxious to have an overcorrection, and that we try to hold it in a classic way. We respect the personality, and we do it in a gentle way, not too much, not overfilled. So more beautiful at the end for me.
Mm-hmm.
Well, thank you so much. And it was an amazing and a very interesting opportunity to talk to both of you tonight. And both of you are so kind and so intelligent. And it was just a very nice, clever conversation. And I'm really sure that our viewers will enjoy a lot. And I invite the people that are watching us when this go on to buy the book. It's a very, very nice book. You should have it to improve your skills in lip injection. And
Yes.
I really would like to congratulate both of you for the work you've done. And I would like to thank both of you for sharing a lot of your knowledge in a short bit of time tonight. Thank you so much for accepting our invitation.
You're welcome.
Yeah, thank you very much for your
Thank
time. Maybe we travel to Brazil next year,
And
so you
visit.
never know. And we can see you on the conference.
Oh,
Yeah.
it would be great. It would be a
Yeah.
pleasure to meet you in person.
Yeah.
Yes.
Okay.
Well,
thank you.
thank you very much.
Thank you.
Auf Wiedersehen.
Auf Wiedersehen.
Bye bye.
Tschüss.
Thank you.